So central nervous system stimulants, which means brain stimulant, so medication that keeps you alert, keeps you awake, are these ones here that we're going to look at. So let's look at nicotine, for example. Nicotine, also known as tobacco, it's an active, so the central nervous system is an active component of tobacco. It basically keeps you awake, it makes you feel good. And as we know, tobacco use is so common. In America, 26% of the adult population smokes. There are cases of children smoking at such a young age, between 11 and 14. In some areas, there's more girls smoking than boys. Cigar smoke is actually very common, unfortunately, these days, and this is partly due to media, because anytime you watch a movie, you'll always see people having cigars. Smokeless tobacco or chewing tobacco is also common among young people. Usually high school boys, they chew tobacco in some communities, and unfortunately when they do that, when we look inside their mouth, we will see signs of like leukoplakia or precancerous lesions, so just lesions inside their mouth that could be cancerous. So we need to keep an eye. That's why it's so important to do an intraoral exam, so that when we see those lesions, we can refer them right away. So how do you manage when you are trying to quit tobacco? Well, first thing you have to know is there are going to be withdrawal symptoms. When you quit tobacco, you will feel anxious. You're not going to be yourself. You're going to be irritable. You're going to have difficulty concentrating. You could have headaches. You could get more hungry. Your sleep will get disturbed. So these are all common symptoms of withdrawal. So there are things to help you with the withdrawal symptoms and with the addiction. Some things I know you guys know of, which is the gum and the patches. And then there's also drug therapy. So they could go to the doctor and get these drugs prescribed. There's also a nasal spray that can help them. So all of these are used to help with the withdrawal symptoms of nicotine. What is our job? Well, our job is to educate the client on the negative effects of smoking. We want to encourage our client in a very gentle way to change their habits. And one of the key ways we can do that is when we give them a mirror and tell them to look inside their mouth, and we point out the staining, we point out the nicotine stomatitis, we point out burns, we point out lesions that we could see in their mouth, and say how that is related to tobacco, because sometimes when they see it firsthand, it means more, and they're more inclined to quit. Psychedelics is a different type of drug that is used. We're going to be looking at LSD and angel dust. So let's look at this one, LSD. So LSD is also known as lysergic acid diethylamide. I can't talk. Okay, let's try that again. Lysergic acid diethylamide. Diethylamide. It honestly, sometimes I have to Google the pronunciation of some of these drugs because they can get to you. So LSD is a drug that people take as a it basically causes hallucinogens, and that basically means that it causes these symptoms. Hallucinations, actually, where you start to see things and you start to hear things. It can also cause dilated pupils, your face feels flushed, your BP goes, skyrocket high, you panic sometimes. So these are all symptoms of taking LSD. Angel dust, or PCP, phencyclidine, is another type of drug, or another type of hallucinogen drug, or psychedelics. And again, it does the same thing. It's actually, just as a side note, this PCP is actually was originally developed as an animal tranquilizer, so it would calm down the animals. But now humans are using it, also known as angel dust. And again, it does the same thing. It makes you hallucinate. It makes you, see things and hear things, and sometimes people like that. Oftentimes, people will have bizarre behavior, disorganized thoughts. So it's a very powerful drug. Marijuana is another type of hallucinogen, and what this does is it heightens your sense of perception. So you feel good, because you feel good when you take marijuana. but unfortunately there are side effects such as these. So your memory is not that good, increased heart rate, increased BP. People are known to have red eyes when they take marijuana, and they can't concentrate. And there's a lot of dental considerations such as xerostomia, so dry mouth, gingivitis, that could happen, right? And then of course we see people that get bronchitis as well. In Ontario, this is legalized. Marijuana is now legalized, so we may see more people using it. And the reason why is sometimes what people say is that marijuana actually has some benefits. And one of the huge benefit is that if someone is going through cancer, this medication, this drug, marijuana, it actually helps treat nausea. And so that's some of the medical uses of marijuana. So when someone says that they're using marijuana, figure out why. Is it because of a medical use, or is it just because, because they like it? There's also synthetic marijuana or man-made marijuana, such as spice and K2. Okay, so it's not real marijuana, it's actually man-made. So again, important things to note is that when we see clients, try to identify the substance user, try to identify the person that is shopping around to get these, get opioids or get these type of drugs. Typically, these people are excellent storytellers and actors. They are so good at acting and at making up stories that they can convince the dentist that to prescribe them the opioids. And usually they'll say, oh no, I'm allergic to this drug, I'm allergic to NSAIDs, I'm allergic to Advil, I'm allergic to Tylenol 3s, so that they can get stronger drugs. So they're really, really good like that. Now this is also common too. What if you as a dental clinician see someone else who's impaired? What do we do then? If we go and talk to them, they may deny themselves, so confrontation is usually ineffective, or often ineffective. And it can affect, when someone is impaired, it can affect the entire practice, because they'll have mood swings and patients will start to sense it too. So it's our duty to report that person to our professional community. So for dental hygienists, it's CDHO. Okay, so you would have to report it to the committee.